Hi, my name is Jason Lowenstein, and I'm an adult and pediatric spine and scoliosis surgeon. My practice specializes in scoliosis and spinal deformity in both children and adults. Today we're going to talk about some frequently asked questions regarding scoliosis. Scoliosis is usually identified during childhood. Most curves that are found are usually smaller curves and are really at a relatively lower risk of progressively worsening. We tend to follow curves very carefully with serial x-rays and examinations to make sure the curve is remaining stable. In the small percentage of cases that do progressively worsen, they tend to get worse by roughly 1 or 2 degrees per year. Usually those curves tend to get worse once they've reached about 45 to 50 degrees. Most cases of scoliosis fall under the category of being idiopathic scoliosis, which means there's no underlying cause which we can identify which explains why the child has developed scoliosis. In these cases, the goal really is to try to identify the curve early and offer close care and potentially treatment to prevent the curve from getting worse as the child gets older. Scoliosis causes a curvature of the spine, and in some patients there's a concern that the curvature will prevent them from being able to participate in athletic activities. While in a small number of patients the curve results in pain, in many patients the curvature does not result in any kind of significant pain, and the deformity itself does not prevent them from participating in normal athletic activities. Living with scoliosis can be very challenging, and particularly when the diagnosis is made, can feel very overwhelming. However, typically, these curves can be treated successfully and patients can go on to live a normal and happy life. The goal is really to identify the curve early and then make treatment options available that can optimize a patient's function and allow them to go back to life normally. Patients undergoing scoliosis surgery oftentimes travel for their care. You can absolutely travel to obtain scoliosis surgery and then travel home afterwards, typically either driving or flying. While both are absolutely acceptable, sometimes flying is easier than driving because there's less turbulence, less bumping on the road, and the ability to actually stand up and walk around during the flight. Scoliosis creates a curvature of the spine and can result in both deformity as well as pain. While some patients do have pain associated with scoliosis, others don't. The goal of any type of scoliosis treatment is to both improve the curvature and also potentially improve the patient's pain. At the end of the day, the goal is to improve both and allow patients to go back to a normal quality of life. There are many different types of treatment options available for scoliosis. However, not all curves need to be treated. Sometimes observing the curve and making sure the curve is not progressively worsening is all that is required. For small curves, that's typically what we do. However, as curves progressively worsen or get larger, both bracing and/or surgery become options available for scoliosis. The most important thing to do is to tailor-make the treatment options for the patient based on their curve and their personal goals. Scoliosis surgery has evolved significantly over the last 100 years. There are many different ways to treat scoliosis, including both fusion techniques as well as fusionless motion-sparing surgeries that are available to patients today. We try to come up with the most minimally invasive option for each independent patient to try to come up with the right treatment option available to them to maximize their function and improve their curve. Scoliosis is a curvature of the spine, In some patients, it's simply a deformity that exists without any type of symptoms. However, in some patients, it can cause significant pain, oftentimes directly over the apex or biggest part of the curvature. Treatment for scoliosis tries to both improve the spinal deformity, but in patients who have pain, to also stabilize the spine and improve their pain. Scoliosis is oftentimes identified early in childhood, and oftentimes the curves are quite small. In those patients, careful observation is oftentimes what we recommend to try to follow the curve and make sure the curve is not progressively worsening. If a curve remains very small, it likely will not have any type of negative effect as the child grows and becomes an adult. And in these curves, simple observation is oftentimes the best strategy for treatment. Scoliosis is oftentimes identified in childhood. In some cases, the curve can progressively worsen into adulthood. Typically, if a curve is somewhere between 40 and 50 degrees, it will progressively worsen as the child becomes an adult and usually gets worse by roughly 1 or 2 degrees into adulthood. In some cases, smaller curves can progress as well. Particularly in the lumbar spine where there's more flexibility, those curves that are in their 30 or 40 degrees can sometimes worsen as the patient gets older. We typically recommend that if a patient is an adult and has a history of scoliosis, if they're having progressive worsening deformity or pain, they should be evaluated for possible progressive scoliosis. Athletic activities are oftentimes encouraged or recommended for treatment of scoliosis. While physical therapy may offer improvement in pain associated with scoliosis, it typically does not affect whether or not the curve progressively worsens or stays stable. Swimming is oftentimes recommended to patients with scoliosis to try to improve their curve. While athletic activity of any sort, including swimming, is great for patients with scoliosis to maintain flexibility and strength of their spine, there is no evidence to support that swimming in and of itself will prevent scoliosis from getting worse. Bad posture or slouching can oftentimes be a concern for contributing to scoliosis. While bad posture is considered to be postural kyphosis or a bending forward of the spine, it's not directly responsible or related to patients who have scoliosis. There are many treatment options available for scoliosis, one of which is bracing. If a curve in a child reaches somewhere between roughly 20 and 40 degrees, typically bracing is offered as an option for treatment of scoliosis. We have great data to support that bracing is very successful in treating scoliosis. And if a patient wears a brace over 18 to 20 hours a day, the odds of the brace being successful in preventing the patient's scoliosis from worsening and requiring surgery can be up to 90%. There are many treatment options available for scoliosis, and some include physical therapy manipulation and chiropractic treatment. While both physical therapy and chiropractors can offer manipulative therapy to patients to improve pain at times, those treatment modalities do not change the natural history of the curve. They don't make the curve straight or prevent it from worsening into the future. Scoliosis is a commonly identified disorder that usually affects children, oftentimes during periods of growth. While curves are oftentimes identified in women, you can also identify curves in young men as well. Scoliosis-specific physical therapy exercises such as the Schroth method are available for patients to try to treat their scoliosis. While the evidence is limited to support that scoliosis-specific physical therapy exercises can reduce or change the magnitude of a patient's scoliosis curve, it can be successful potentially in improving pain and function. However, there is evidence to support other treatment modalities such as bracing and surgery, which may be available for patient treatment. Women who have scoliosis oftentimes become pregnant, and absolutely women who have scoliosis can go on to successfully have children without any type of complication. In fact, even in patients who have had to undergo surgery for treatment of their scoliosis, they can still go on to have children without any type of complication. Oftentimes, patients with scoliosis that are identified as children are told if their curve is less than 40 to 45 degrees when they're done growing, that they have a low likelihood of curve progression into adulthood. Unfortunately, a certain number of patients will have progressive worsening of their curvature as they become an adult, and oftentimes these curves will get worse by roughly 1 to 2 degrees per year into adulthood. If you're interested in learning more about your scoliosis or wish to see us for an evaluation or a second opinion, please don't hesitate to contact our office and we'd be happy to see you.